Good evening once again. Opioid addiction, now the 13th qualifying condition in the state's medical marijuana program.
The designation gives healthcare providers more options to tackle the opioid crisis. But experts say getting any kind of reimbursement from health insurance companies is virtually impossible. More on that now from 7 Eyewitness News reporter Hannah Bueller.
It's the kind of pain that changes your life because you can't live like you used to.
For Jonathan Fisher, after multiple car accidents, excruciating pain is something he deals with every day.
So every day becomes about avoiding your pain and doing everything you can to make it less.
But one thing that he says helps him more than any medication on the market, medical marijuana. But that drug, while legal in New York State, isn't covered by insurance companies.
I mean, it's way more than you pay for an opiate prescription because insurance would cover it. So you'd pay, I don't know, $3 for a prescription that'll last you a month, whereas I'm paying $350 to $400 for what gets me by through the month. I'm not talking about what gets me through the month, what gets me by.
Medical marijuana has been proven to help reduce opiate addiction, a growing problem across the country. But opiates, which can be highly addictive, is covered by insurance because it's federally regulated. Medical marijuana is not.
I would say out of 5,000 patients I have, easily 30% come back and say, it works, I just can't afford it.
Dr. Laszlo Meschler of Dent Neurologic has lobbied in Washington for marijuana to be switched from a Category 1 drug to a Category 2 drug. Currently, it's a federal issue, and even though it's legal in New York State, insurance companies can't cover it.
We need support from not just New York State, but the federal government, so physicians could do the appropriate research.
Until that time, patients like Fisher will have to pay out of pocket.
The premise behind it all is absolutely ridiculous and unfounded, period. There are no excuses for it.
I reached out to several Western New York insurance companies today, and they all pretty much tell me the same thing. They can't cover medical marijuana because it's not approved by the FDA. They just tell me their hands are tied. We're live in the newsroom tonight. Hannah Bueller, 7 Eyewitness News.